Most of us have an annual wellness visit with our primary care provider. But are you getting the most out of your annual screening? Here today to share some tips on how to make the most of your yearly wellness visit is Dr. Schopmeyer with Baptist Medical Group. Good morning, Dr. Schopmeyer. I'm so excited you're here.
Thank you. Thank you for having me.
This is going to be a great topic because I have a lot of experience I can relate it to, but I'm also really thrilled that I can pronounce your last name. That doesn't happen often with the doctors that we have on this show.
Well, I'm glad you can get it right. Some people do mess it up.
Yeah.
And,
yeah, it's pretty exciting. But first of all, tell me a little bit about yourself and what you do.
Well, I'm new to the area, moved down in July. I have a beautiful wife and 3 great kids. I'm board certified in family medicine, and I practiced for 4 years outside of residency. And I am at the clinic Florida Blue on 9th and Airport.
Which I think is fantastic because we were kind of talking before the show, and I had a tour of Florida Blue. Had no idea that Baptist had doctors and nurse practitioners out of the Florida Blue facility. Had no idea.
Yeah, that's the big problem we're facing right now is the community doesn't know we're there. So we're trying to get the word out that we do have a clinic there right in the heart of Pensacola.
Yeah, it's near everything, really close to my work. I mean, it's super convenient. The facility is really nice. I mean, I can't imagine why anyone wouldn't want to take advantage of it. It's pretty
Absolutely.
neat.
That's what all our patients say. You know, they're just amazed at how convenient it is.
Yeah, absolutely. Well, we're here to talk about annual wellness visits, which I just hit my 30-year mark. And so I decided, myself, it was time for me to get an annual checkup. Sometimes can be kind of a pain making those appointments, but what is a physician looking for at the annual wellness visit?
Well, the really important thing about the annual wellness visit is that we want to keep you healthy. So if you come to your annual wellness visits, hopefully you'll come to me less for sick visits. So that's the whole key about the annual wellness visit. A physician at the wellness visit is looking really to do 3 things. One is to prevent disease from occurring. And we do that through immunization and screening and physical exam. 2 is to diagnose any problems that you may have that you're unaware about, or maybe that you are trying to deny that you have. And 3rd is if you do have a chronic illness, we want to optimize that medical problem so that you're having less issues dealing with that disease process.
And I think it's really neat to mention that the Florida Blue office where you work out of does provide like blood work tests and immunizations and all those different things too.
Yes, we have lab right there on site. Great phlebotomist that draws.
Yes, fantastic. I can definitely speak to that.
Yes,
She's
absolutely.
great.
And then we do provide not all immunizations, but we do flu shots, pneumonia shots, and then if people need direction for their other immunizations, we'll definitely tell them where to go and how to get those provided to them.
So when a patient is coming in for their visit, what kind of things do they need to bring with them?
I encourage all my patients to have a list of their medications on them at all times if possible, because you never know when you're going to end up in the hospital. It's a good idea to have a list of medications, your list of your allergies, your chronic disease problems, and then when you're coming to your wellness visit, it's a nice idea to have a list or an idea of what screening you've had done and your immunizations. And after that, so we can get all that put into the system and get your chart updated. If you have a list of some problems that you want to address too, obviously the physician's job is to dig some of that out of you.
Right.
But if you can have as much upfront as possible for us, it makes our job easier.
Well, and I'm sure digging sometimes is a common thing just because people don't want to necessarily admit that something seems a little bit off because to them it could be, this is a crisis. And I know I tend to go to that panic mode too of like, oh, should I tell them? I don't know if it's a big deal or not. What kinds of questions when you're going in should you be prepared to ask?
We're going to walk through a lot of things. We want to screen for mental health issues. We want to, talk to you about if you have some weight issues, whether underweight, overweight, and address those because, nutrition is the key to health. Nutrition and exercise, I push that a lot in my clinic because it's the key to staying healthy for the most part. So, bringing those type of questions are great. And then, any questions about medications that you're on, and asking the doctor if there's any new medications. Is this the best medication for me to be on for this disease process? Those are the type of questions that we want to answer for sure.
And, coming of age, we kind of geared towards seniors. And I'm just curious, is there something that seniors specifically need to be aware of as they age, and as far as what type of provider they need to be seeing?
Yeah, so that's a great question, and a lot of people don't understand kind of the physician's training. So I'm board certified in family medicine. I did a family medicine residency. So I am trained to see patients from even deliver babies, and have experience and was trained to see patients in the nursing home. So I'm trained for broad scope medical practice. Internal medicine doctors are also trained to see patients ages 18 and above, and they have more hospital training than we're more clinic based, although we can see patients in the hospital via our training. So really we're both geared to treat those chronic diseases as far as family medicine and internal medicine. There is a specialty called geriatrics or a geriatrician. They're few and far between, and usually they're more geared at practicing in a hospital or in a nursing home. But as you age, if you did have access to a geriatrician, they would be a fine practitioner as well. But I don't think somebody should go seeking a geriatrician if they're comfortable with their primary care doctor. I think the focus, whether you're seeing a primary care family medicine doctor or a primary care internal medicine doctor, you want to be comfortable with your doctor. You want to have a doctor that is interested in your health and is interested in you as a person. And I think that's primary, and that's what I look for in a doctor as a physician, because I know if I'm seeing a board certified physician, they're trained, and they're and medicine is so broad, nobody can know everything.
Right.
I want a person who is interested in me as an individual, and I think that is key to find over where they were trained or how they were trained, is make sure that they are interested in you.
Well, I think one of the most frustrating things sometimes about these appointments is even, first of all, getting an appointment in a timely fashion. I mean, I've definitely been in a position where I've had a sinus infection or something like that, and I've ended up in urgent care because I couldn't get the appointment I needed with a primary care doctor. But Florida Blue is a little bit different right now. I know you guys are building your patient base. Tell me a little bit about what the process is like for someone who needs an appointment and could get it at Florida Blue. Yeah, so absolutely. Right now it's a really nice streamlined process. Basically, we want people to call and schedule an appointment. They can call the office at 850-479-3790 and schedule an appointment. The trick with the Florida Blue Clinic, obviously, is you have to have Florida Blue insurance. Sure.
So that's the only key to being seen at our clinic. You'll come in, fill some paperwork out prior to your appointment, and we see you pretty quickly. We've even seen people, the day they get their insurance, they walk over from the insurance retail, which is on the other side of the building, and they walk them over, they schedule their appointment, and I've even seen them the same day. So it's
one-stop shop. Well, this is great information. I wish we had more time, but like you said, you mentioned the phone number if someone wants to schedule an appointment. But thank you so much for joining us. We really, really appreciate it.
Well, thank you for having me.
Thank you.